Hello everyone. Welcome to my channel Study Nursing by Sense School. Today in this video we are going to discuss about a nursing care plan, risk for fall or risk for injury. And if you are someone who is visiting the channel for the first time, I would suggest you to have a look at Introduction to Nursing Plan, where we have discussed all 5 steps of nursing care plan with examples. All right. That being said, I would like to start with the care plan. And before we do that, let me also tell you that this is not an actual problem, but a potential problem. So when you take care of nursing care plan, you have either an actual or a potential problem. So depending on that, you need to adjust the interventions. All right. That being said, let's move on to the assessment session. In the assessment, you have two data collection. One is the subjective data and other is the objective data. In subjective data, you collect what the subject tells you. So in case of risk for fall or risk for injury, you will probably not be writing where the patient tells you that she or he is going to fall. They never do that, all right? But you can elicit some of the elicit the risk by taking up some of the statements they tell you, such as they feel dizzy, they are in severe pain, they cannot see properly, or they haven't eaten at all. So I've given you some of the subjective data, so you can take up and write or rewrite accordingly. When we talk about the objective data, you're gonna observe and take a couple of data. You're gonna assess and record some of the data that include vital signs and height and weight monitoring, the MUS score, the BMI calculation, any disease condition that your patient has, such as postural hypotension or vertigo. All right. You will also access, you will also observe the patients for mobility. For instance, if that person requires any mobility assistance, or has he or she been using any aids for walking. So these are the objective data that you would record. And most importantly, you would also assess the surrounding for hazards. That includes wet floor, or the floor has got any spillage, any medical devices are being cluttered. Sometimes we do have it when we gather all those IV pumps or infusion sets, and then patient's room or ward is surrounded by those medical equipment. So that being said, let's come back to the point. We assess this surrounding for any hazards. That includes sharp objects, any medical devices, the floor for any wetness, or any slippery floors, anything like that could be hazardous. And what would be our goal? Our goal would be the patient remains safe without fall or injury. This would be the goal of a nursing plan. Intervention and implementation. Let's move on to the steps that you would consider for a patient who is at risk for fall. You would monitor the vital signs. Why? To capture the idea of how much blood pressure the patient has, the what about the heart rate, are they going into any hypotension. We would also take and record the height and weight of the patient, if they have been eating or not. We would also assess the mobility, how they have been walking or mobilizing at home and how they are at present. We would also look for the patient's footwear, whether they are using any slippery ones, the ones with the heels, etc. We will clear any obstacles that are there. So in the intervention, after assessing everything, we would do the interventions, right? We would provide any non-slippery shoes, or any of the safe footwears that they have, or even recommend that they bring it from their homes. That's also possible. We clear or remove any obstacles, and the use of side rails is a bit gray area, where the nurses need to be a bit careful. If you're preparing a care plan for a patient who is having seizure, then this makes sense, right? When a patient is in active seizure, he or she has got the risk for fall or injury. Hence, we provide the side rails for the bed. Otherwise, if it is not indicated, let us not restrict the mobility of the patient. All right. And the next point is to make sure that things are within reach so that they are not overextending and then predisposing themselves to the fall. So these are a couple of interventions that I have given. Evaluation: a patient remained safe during the shift. This is my evaluation. I'm going to give you a scenario. Let's see how we implement these points that we discussed. I'll take you through the scenario where an 84-year-old female named Alice is admitted in the ward with fever. She mobilizes with assistance of one and has not eaten because of fever and discomfort. This is your scenario. So you formulate the diagnosis of risk for fall or injury. But before we do that, we'll take up some subjective data where Alice is telling you that she feels dizzy and she feels tired to get up. She is 84-year-old, remember, and she has got active fever as well. On observation, I record the baseline vital signs where I got below normal value. Her must score is a bit low, and pain score, I would say she has a pain of 6 by 10, which is mild to moderate. Um, and I would assess Alice for the mobility. I would check how Alice was doing when she was at home, and how Alice feels now that she's hospitalized, how she would like to be assisted. And any existing underlying condition for Alice, I would check for that, and I would make sure I write in the care plan any history of fall, and I would also assess the bed area for any hazards or obstacles. So this is what I would record in the objective data. What is my nursing diagnosis? My nursing diagnosis would be risk for fall or injury related to disease condition, as evidenced by verbalization of dizziness and observations. Remember, when it comes to different patient, each person or individual is unique. They might have their own, challenge, and you need to rephrase and rewrite the nursing diagnosis accordingly. This is just a sample that I have given you. Now that we have the nursing diagnosis, we plan for a couple of intervention. And for this patient, and for my patient, what I would do is, depending on the vital signs, for instance, I observe that my patient has hypotension and she has not eaten in quite a while. So I would escalate it to my medical team, and as per the order, I would start with the IV fluid and rehydrate the patient. I would also take necessary step to bring down the temperature, such as whatsoever intervention comes. So the rationale that I would give for these points is to bring down, to bring more comfort to Alice, and thereby reducing the chance of fall. All right. This is my rationale. And point number two would be to provide any of the walking aid, and rationale would be to enhance the mobility and thereby bringing down the chance of or the risk for fall. I would also ensure, once I discuss with Alice how much lighting she would prefer for the room, or anything I can do to provide optimum lighting for the room so that my patient can see well. And the rationale would be the same, to reduce the risk for fall. And at the same time, I would also provide call bell to the patient, and things are within the reach of Alice so that she's not stressed up, she's not overextending and predisposing herself to fall. So I'm not going to do that. I'll make sure that things are in place and everything is safe for my patients. So these are the couple of interventions that I have come up with, but feel free to write down in the comments what all interventions you would prefer or you would consider for the patient. Yeah, all right. And let's talk about the evaluation or outcome. By the end of the shift, Alice is safe. I would not write by the end of the shift, Alice has no injuries or Alice has not had a fall, because that changes the framework to to a negative one. Rather, I would write, by the end of my shift, Alice is safe, which is rather a neutral sentence, and it implies that you had a positive outcome, all right, for all your intervention. So, with this, we have come to the end of the video. I hope you had enjoyed the video. If you liked it, please consider subscribing to the channel. I wish you all good luck with your nursing career. Thank you.